Hi, this is Dr. Jayalakshmi, Mithran Dental, Adyar, Chennai. Today I am going to discuss with you regarding habits. All of us have some kind of a habit. In recent times, if you see, checking into the phone often or being in social media for a long time has become a habit for many of us. Like this, one another habit in children is thumb sucking. During the growing years, that is during the early stages of the child, it is quite normal for them to suck their thumb because it is a part of the growth reflex. This sucking of thumb actually helps them to feed and grow. But as the child grows, it should also wean out of this habit. By at least 4 to 5 years, the child should be completely out of this habit of thumb sucking. Because if in case they tend to suck their thumb even beyond 5 years, what happens is that it leads to developmental changes in the teeth as well as in the jaw. As well as the child might not be able to pronounce few of the syllables well because of the positioning of the teeth that which happens from the thumb sucking. If in case the child is going to suck its thumb even beyond 5 years, the permanent teeth will start to erupt. So what happens is that the pressure from the thumb can lead to flaring up of the teeth in front, that is the upper front teeth could go about flaring, which we call overjet. Or the child might have an open bite, wherein the upper and the lower front teeth will not come into closure at all even if the mouth is closed. So to avoid all of this, we will have to intervene and stop this habit. There are few of the home remedies that which I can discuss with you, which could help you to help the child grow out of this habit. First thing is that create awareness for the child. Make the child aware that he or she is sucking its thumb. Because many of the times the child tend to suck its thumb very unaware, because even if they are getting bored or when they are feeling lonely, they tend to go back to thumb sucking habit. So make the child aware that he or she is sucking her thumb. Then praise the child. If in case the child makes an attempt to grow out of this habit, maybe for an hour or two, if they have remained without thumb sucking, then definitely we will have to praise the child. When we are giving this praises, it will act as a positive reinforcement for the child and make them get motivated to grow out of this habit. How you can do is that you can put a star chart for the child. You can give stars for the child for a day if in case they are going to remain from thumb sucking, or if in case even for an hour they are going to remain away from thumb sucking. Or you can even present the child with toys or gifts which will help them to get motivated much better to grow out of this habit. And always employ the child with some kind of a favorite toy or with some kind of puzzle so that their mind remains active and they don't go back to this habit of thumb sucking. Only when the child gets bored or tired, they immediately go back to this habit of thumb sucking. So actively employing them will also make them stay away from this habit. Apart from this, there are many nail lacquers that are available in the pharmacy, that which you can buy and apply it over the child's nail alone, not over the entire thumb. This I usually advise my patients to apply it when after the child has gone to sleep, because subconsciously during their sleep the child will get a rejection towards thumb sucking, because the bitter taste in the nail lacquer will not allow the child to suck its thumb. Other than this, you can apply some of the home remedies also, like applying a neem oil or a pudina paste or an aloe vera gel, all of which will give a bitter taste for the child and help the child to grow out of the habit. Or you can give some band-aids onto the child's hand of their favorite cartoon or something like that, so that also motivates the child not to suck the thumb. And you can at least apply a mitten onto their hands, which gives them once again a difficulty to suck their thumb. If in case any of these home remedies is not working for you and the child happened to suck its thumb even beyond 5 years, it's better that you seek your dentist's help, because we dentists will give the child an appliance that is to be fixed inside their mouth. This appliance will help the child to grow out of this habit. Hope this video is helpful for you. In the next video, that is on habits, my next video on habits, I will upload information onto the appliance that which we give for the child to grow out of this habit, and share some of the treatment results too, so that you get a better idea. Thank you.